Welcome to American Medicine Today, presented by the Bonati Spine Institute, the world leader in advanced spine surgery, featuring the internationally acclaimed inventor of the Bonati Spine Procedures, Alfred Bonati, MD.
Today we'll inform you of the incredible success Dr. Bonati and the Bonati Spine Institute have achieved for over 30 years and over 45,000 procedures for patients that were living with back and neck pain, and have a discussion on the state of the medical crisis that's happening in our country today, better known as Obamacare. Dr. Bonati advanced medicine to a new level, allowing many pain sufferers to achieve results on treatments pioneered while advancing the field of knee, shoulder, wrist, ankle, and other joint ailments using arthroscopy. Dr. Bonati is credited with patenting and perfecting the field of minimally invasive laser spine surgery called the Bonati Spine Procedures. We'd like to start today's program with a conversation I had with Dr. Bonati to discuss his patented Bonati Spine Procedures and the world-renowned Bonati Spine Institute. Dr. Bonati, I know about the Bonati Spine Institute, how you're located north of the Tampa Bay area at US 19 and Hudson Avenue, a beautiful 11-acre facility. From your words, why don't you tell us about the Bonati Spine Institute and how it all began?
The Bonati Institute is a comprehensive facility where we can serve all the needs of what we do for the patient. So it's going to be like a one-stop shop. Why I say that? Because we can evaluate the patient. We can study the needs for that evaluation, from the laboratories to the x-rays to the magnetic resonance, so they can get the information for that patient that may need surgery, give to the surgeon the information that that patient is in a safe situation to be operated. So it's a comprehensive facility from that point of view. The other point of view is also a comfortable facility, because allows the surgeons to be sheltered on a system serving only that facility, so they can relate personally to the patients.
Is that something that you designed? Because, well, Dr. Bonati, I'm not sure that anyone else is aware, but you designed that facility.
I designed the facility because when you practice medicine, and you are in a hospital environment, you have a lot of discomfort. If you look at our facility at the same time that we do surgery, when we finish surgery, we can move to see a patient. When we see a patient, we can schedule MRIs, X-rays, or laboratories, and physical therapy, and whatever is necessary for the patient, and then move them in that direction. So the Institute allows not only the patient to have better service, more careful service, and more service of direct contact with their physician, but at the same time allow them the physicians to be more comfortable to deliver this care.
Now, Dr. Bonati, a lot of facilities, and I have to preface this by saying, you started what's called minimally invasive laser spine surgery. Now, I know nowadays you typically shy away from promoting that because some other imitators out there kind of blur the issue, but it was invasive open back surgery and then your patented Bonati Spine Procedures that were able to exactly pinpoint and get to the root of people's pain. Why don't you describe some of your surgeries and what really sets you apart nowadays from anyone else on the market?
Well, we are highly successful because we have an incredible amount of experience. Remember that these procedures are being practiced and the evolution of the procedure is very small. So initially we did a little thing here, then we found that the results for the patient were not good, then we changed some tools and we modified the procedure, and that thing evolved through years. So we have 45,000 procedures performed. When you talk about 45,000 in one facility, I don't think there's any facility in the United States who has that amount of experience. So it's not that we are better, it's that we learn more. And in the process of learning more, I was able to teach my colleagues that work with me things that other people don't see.
Correct.
One of the things that you need to remember is that when you do open surgery, you destroy a lot of tissue. The incision is around 6 inches, so you need to go all the way down there. It takes a lot of tissue apart. But your eyes are only 20/20 if you are 20 years old or 30 years old. After that, your eyes need some help. And usually a good surgeon is not a 25 years old guy. It's a guy in his 50s, 60s, or 70s. Those are the guys that really know what's going on, because they already saw everything. Well, when you go and you look at this person who is doing open surgery, and his eyes are helped with glasses, but the distance from the eyes to the body is around 1/2 meter. And from the distance from the body to the area of the spine that you're going to operate, it's around 6 inches. You're talking about a long distance to see a space of maybe an inch where the problem is. Well, how about if we simplify this? Instead to open all that incision and get all the way there, why don't we put a little tube that gets exactly where the area of the pathology, and once it's there, you use a telescope, an arthroscope that is going to increase your power of your vision 40 times normal. If you look 40 times your eye effective vision, you can see everything. The size of your hair looks like a rope. So possibilities of injuring tissues are decreased. Possibilities of infection are decreased because meanwhile you are looking inside, you need to be watching the arthroscope, or otherwise it becomes hazy and you don't see anything. So you use antibiotics and saline to constantly watch the area. So you are soaking all these tissues in antibiotics just under the possibility that you can have an initial infection there. The proof is that in 45,000 surgeries, we never have an infection. And when you talk about situations of infections, they are usually a small infection on the skin because the suture become reactive and the tissue react there, and then we just clean a little bit the incision. That's it. But we never have an infection. We don't have meningitis. We don't have infections. We don't have osteomyelitis. We don't have problems. With open surgery, all those things are routine. They are part of the complication.
Do you have any want to stop doing what it is you do?
Well, the people said I'm going to die with my boots on in the operating room. The point is really truth. The majority of the people have hobbies. My hobby is surgery. It's an amazing feeling to get somebody who is by themselves believe that they are at the end of their life, at the end of their careers, at the end of their productivity, and then suddenly in 24 hours turn them around. It's an ego trip that is probably better than any drug that you can imagine. Your adrenaline goes crazy.
When we come back from a short break, we will speak with a former patient who received treatment at the Bonati Spine Institute, and he'll tell you firsthand how the patented Bonati Spine Procedures helped him.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
Welcome back to American Medicine Today, presented by the Bonati Spine Institute.
What I gather from the Bonati Spine Institute is that it's not a one surgery fits all. You treat everyone like a person, not just a number, and everything that is done for the patient is based on their specific needs.
It's amazing to see every patient is different. From their presentation to you, to the behavior with you, the way that they believe you, and the way that you respond to them. There are people that become very angry. There are people who have 4 or 5 surgeries on the back. They don't believe that you're going to help them. Practically, the wife or the friends or somebody grab them from their hairs and bring them in and say, listen, what they can offer to you. Well, the situation with that is that some people are not, they cannot believe anymore that they can get better because it's too many other situations that they deny the possibilities. When they get better, it's like the fans in a show. They really believe that you can deliver and do, let's call in a different way, but they believe that we can create the miracle for them. And when that happens, it's very rewarding for everybody. It's rewarding for the nurses, it's rewarding for the doctors, it's rewarding for the personnel that is there. So that is why you will see that in our facility, the people are happy and the people that serve the patients are respectful and are tactful and become like a family.
He'll go in to a nerve and just slightly clear the area around it so that it has a flat bed to lay on, remove edges around it that we're talking about very, very small spaces, and a very, very steady hand, which is quite amazing.
It's very happy. Our win percentage, our success percentage is very high, much higher than I had before I came here when I thought I did good minimally invasive surgery. That's a way to, it puts a little bounce in your step going home when you're tired. And I look forward to coming in the morning when we have a whole new week's worth of challenges.
The most profound improvement I had seen was an older woman who came in a wheelchair with her husband, and her head was bent over, and she did not respond to our questions. Her husband responded for her. And after her first surgery, she seemed to improve a little bit. And then after I think it was her third surgery, she started to sit up and started talking. And I said, I didn't know you were able to speak. And she says, I was in so much pain I couldn't. So she went from her wheelchair to a walker and then to a cane, and then she walked out of here. A whole other person. There was a blossoming of a human being that was quite amazing.
Sometimes it's just funny that I go to a restaurant sometime today. I saw a patient who was operated this morning and he's just waving at me. And it's funny to see, but you become accustomed. It's like, that's what I do and this is what I expect. So in the very beginning was just a thrill. Today is, well, that's what I do.
I think we see that a lot as far as many patients have been to several doctors, several different methods in trying to deal with their problem, and oftentimes on a large amount of medication. And to take those patients and help them by relieving the pain and thereafter being able to detoxify off narcotics and then go back to being productive, I think that's very rewarding.
Well, it's amazing to see somebody who is sick and is without hope and has situations where they were already told that nothing can be done, and we can correct that.
Now we'll see a patient testimonial from the Bonati Spine Institute in our Back to Life segment.
I mean, I enjoy playing golf, and if you have any kind of back or neck problems, playing golf is just not going to be in the cards. So that was really hard to do. And for a time period, I would end up and try to adjust my swing a little bit because the neck was hurting or the arm would hurt, and I would try to take some medication and do a variety of different things, and it just got progressively worse to where you can only put up with pain so long and then you need to do something. But I thought that I was always going to be able to participate at a very high level of athletics or just entertainment or enjoyment or anything in my life. I've always felt that I would be able to do that. And working out or exercising was really not the answer because there was too much pain that was in the neck, the arm, and in the shoulder. And so it was really debilitating to me on what I was able to do and what I was able to enjoy. And I knew that there were different procedures out there, but I also knew that Dr. Bonati's surgery, I knew that he was pretty much the guy who invented the minimally invasive surgery. I also knew that he had conducted surgery on a very high-profile professional golfer. And I know that that professional golfer ended up and he recovered in an extremely quick time period. And so that was just kind of enough of a story all by itself to say, and I have a lot of confidence in Dr. Bonati because of his ability and the talent that he has and the successes that he has. So I was really, I was very comfortable. I had two neck surgeries in a 3-day time period, and I ended up and there's no stitches. I was hardly out of work at all. I had recovery that went really pretty fast. I went to physical therapy over the course of the next 3 to 4 weeks, and I played in a tournament 4 weeks later after that I had the surgery. People that I talked to, they said they just could not believe that I was able to play and participate and swing with a swing speed very similar to what I had before. So probably about 2 weeks after that, a total of about 6 weeks, my swing speed was back to the same that it was before, and I was hitting the ball as far as I had before, and I was totally healed. So I was really excited. I mean, it changed my life incredibly, and I was just very, very thankful for that.
Bob White is a patient who came to see us because he had a cervical problem, 2 levels, and he practically was abandoning the game of golf, and that's his passion. And he consulted us and we talked about it, and then we told him that we are going to correct that. Well, he looked at us like every one of our patients, yeah, okay. But they never expect the results. They expect that they're going to be better, but they don't expect, I can't believe that this thing I was so bad yesterday and I'm great today. They don't believe that. And the whole thing is just only common sense. When you do surgery, you need to apply common sense. And the common sense in the spine surgery is free the nerve that is being affected by whatever the cause. If the nerve is free, it's going to work. So you need to create the path, or you need to create an element that releases the nerve from whatever the cause that is producing pressure on the nerve. That's the whole idea.
Well, first of all, the success and the track record he's had, he ended up and pioneered this, and so he's the guy that invented it. The ability that he has, I think, is just, it's very easy to get through the surgery. The healing process was very easy. It's hard to argue with success, and I'm very thankful to him and to be able to recover the way that it did and how quick that it went, and everything he told me that was going to happen, happened.
All my pain is gone, gone, gone.
Today I am totally pain-free. Nothing. No after effect.
I'm pain-free, and I have had to take any pain medication.
Today I am pain-free for the first time in over a year, and it is so awesome.
I only wish I'd known about it earlier. Right now, I am completely without pain.
Sitting here in this office right now, pain-free, eager to enjoy the rest of my life.
I am feeling great.
I feel 100% better, like a new person.
Today I feel absolutely fantastic. It's just incredible, the relief I feel right now.
Today I'm completely pain-free.
During the procedure, I literally felt the pain melt away. It was fantastic.
I feel so good.
It took care of my headaches instantly.
It's incredible. It's really incredible. It gave me my life back.
It's just wonderful. I feel fantastic.
It is just absolutely amazing.
So I'm hoping to be climbing hills in a few weeks.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
Welcome back to our final segment of American Medicine Today, featuring Alfred Bonati, MD.
So, Dr. Bonati, why don't you tell the viewers, what do you hope to accomplish with American medicine today?
I want to get the viewer to help me to change the irresponsible politicians, the irresponsible insurance, the physicians to wake up and be doctors who serve the patients, and instead to be all the time thinking, I need to do the proper work for the government so they can pay me X amount of dollars, instead to be running behind Medicare irresponsibilities or Medicaid irresponsibilities, or now the wonderful Obamacare, that is the most, how do they call?
Supposedly the Affordable Health Care Act.
Isn't that a funny thing? Is the less affordable? Is the unaffordable Scare Act?
Scare Act, I like that.
No, it's a Scare Act. It's not Care Act.
Right.
So
why should anyone listening back what you're saying? Why do they need to participate?
Because I really think that people will wake up. When you start to see your wife sick and you cannot offer the proper care, or your child that needs to go to the hospital and he cannot go, or when you break a leg and you need to get a piece of wood and put it around your leg and put some wires because no doctor's going to see you, then you're going to see how you wake up. So let's wake up now that we can control. Let's remove the doctors for doing paperwork for the government and for the lawyers. Let's put the doctor to do medicine. Let's retrain the nurses to nurses that they are going to be responsible to give you back rubs and take 2 or 3 patients per service, that they are totally responsible for these patients. Individuals that they love medicine and they love the opportunity to serve, they walk out because they destroy them physically. They put them in horrendous type of schedules. They need to work at night. They cannot sleep during the day, and then they have schedules that they are totally irrational. At the same time, they have not enough training. They pay $2 here. They need to work another place to get another $2. No, these individuals, they need to be paid well. These individuals are your life. They're your future. They're the future of your children. You need to check these things in a certain way, that we need to start to be awake and give the right value to the right things.
Let me ask you, where do you see American medicine heading?
It's going to be a medicine very much similar to the one in Europe. That nobody cares for the doctor because they are not really doctors. They are poorly trained individuals. They work from 9 to 5, and at 5 and 1 minute, They drop everything that is going on and somebody else needs to take over. So it's not even continuity on what you diagnose, because the problem is these poor guys, they need to see 100 people in the morning and then to do 10 surgeries in the afternoon. I mean, it's crazy. So no, this is a disaster and it's only political, only.
Where do you think medicine could go if we take charge of what's happening and we turn it around?
If the society and the people do the first movement, get the politicians to be responsible to what they offer to you. If they offer to you something and they don't deliver, these people has two options. Or they go to jail. Because what Obama did to this country, that man needs to go to jail. This individual destroyed this society, destroyed medicine, and is creating a lot of individuals that they are practically slaves of the government. He is a disaster for this nation.
Do you think that innovation will continue to happen? I know you were completely innovative with your specific procedures, but with tools and development and cures for things, do you foresee heading down that same path if the Affordable Health Care Act doesn't get overturned?
No.
If the Affordable Health Care Act doesn't get overturned?
No. Unaffordable. It's not affordable, it's unaffordable. The unaffordable, scary trust for the health care. If that happens, we have no opportunity to create new devices. It's on the law that if you create a new device, you need to pay a tremendous amount of taxes. Who in his mind create that law? To me, it's only that they want to create a medicine of the GP, a general practitioner medicine. So it's no advances, no cost, no expenses, and everybody has a little doctor who's going to see you, but he's going to take care of your bunions, the same thing that's going to take care of your brain. So we have a little problem with that.
Dr. Bonati, thank you for sharing your time with us.
Thank you for...
And thank you for tuning in to American Medicine Today.
Thank you for watching American Medicine Today, presented by the Bonati Spine Institute. Please look in your local listings for our next regularly scheduled program. To hear more from Dr. Alfred Bonati and American Medicine Today, tune into News Radio 970 WFLA, Saturdays at noon.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.